It's evident that the DCCC, perhaps more so than any other left-leaning organization in the country, isn't just a barrier to progress, but they're now officially an enemy of the people. Because they are fighting against a policy, actively so and aggressively so, that would save lives. Why? Because they're corrupt. And as Alex Koch of TYT Investigates reports, DCCC scores cash from health insurance lobbyists as it advises candidates against Medicare for all. So make no mistake about it, even though this is legal, this is still overt corruption. It's as close to a quid pro quo as you could possibly get before it becomes officially illegal. Because think about this, they're taking money from health insurance lobbyists, one prominent health insurance lobbyist, as we'll get to in the article here, and they know damn well what that lobbyist wants. It wants them to instruct their candidates to not support Medicare for all. That's corruption. That money is corrupting them. It's having a corrosive influence on democracy because it doesn't matter that their own base, more than 70%, more than 80%, in fact, in some polls, support Medicare for all. Because they're taking this money, they're fighting against it anyway. So as the article states, in April of 2017, the Democratic Congressional Campaign Committee wanted to find the best way for its candidates to address the topic of healthcare. So it hired 2 research firms to conduct internal polling focused on 52 battleground districts expected to be close races in 2018. Stan Greenberg, a pollster and founding partner with Greenberg Quinlan Rosner Research, presented his findings at the offices of the Democratic National Committee and suggested that Democratic candidates should focus on flaws of Republican plans and offer proactive solutions only if asked, as The Intercept reported. Campaign finance disclosures show that one of the DCCC's biggest fundraisers is a lobbyist whose firm, Subject Matter, has been working for United Health Group, a health insurance giant that supports further privatizing Medicare. Subject Matter's founder and top lobbyist, veteran Democratic staffer turned lobbyist Steve Elmendorf, has been bundling contributions for the DCCC, and in the current election cycle, he's raised at least $164,000. In total, bundlers have brought in close to $1.6 million to the DCCC in 2017 and 2018, making Elmendorf single-handedly responsible for more than 10% of the DCCC's bundled donations. On behalf of United Health Group, Elmendorf has recently lobbied Congress on a health insurer tax that is part of the Affordable Care Act. Earlier lobbying records detail the company's goal to repeal or delay the tax. In January, the tax was delayed 1 year and will not go into effect until 2019. Elmendorf also represents kidney healthcare company DaVita, having recently lobbied Congress on issues related to Medicare payment for end-stage renal disease and Medicare Advantage. Subject Matter's other corporate lobbying clients include Facebook, Ford, Goldman Sachs, and Verizon. Personally, Elmendorf has contributed $16,400 to the DCCC since last year and thousands more to at least a dozen moderate Democratic candidates, none of whom have publicly supported Medicare for all. Now, I want to get back to the first part of the article where they talk about how they're instructing Democrats to only focus on the flaws in the Republicans' plan and not actually come up with proactive solutions themselves. Because guess what? We just saw a report in Politico by Jennifer Haberkorn where she talks about how Democrats are in fact running on healthcare, but would you look at that? They don't have a message of their own, and they're only talking about how Republicans sabotaged Obamacare. That's true. Premiums have gone up since Donald Trump took office, and additionally, millions of people have lost their health insurance. And this is a direct result of Donald Trump and Republicans trying to gut the Affordable Care Act, and they've taken aim at it in a multitude of ways. They've hollowed out the law. So what they're doing is, in fact, harmful. But the problem is that if you only talk about the flaws of what the Republican Party is doing, but don't have a solution of your own, that's not going to resonate with voters, because the logical conclusion is, well, okay, if Republicans are destroying Obamacare, then what are you going to do? Isn't Obamacare bad? I mean, this is why Republicans have felt emboldened to destroy Obamacare. It's because Democrats do not know how to make their case, and because they don't stand for anything with regard to healthcare, even though they claim they do. Just this last week, Tom Perez, in an interview with either someone from CNN or MSNBC, he talked about how Democrats believe healthcare is a right. Now, ask them if they support Medicare for all. What do they say? we believe in defending the Affordable Care Act, and, we want to stop Republican attacks against it. So essentially, they've co-opted the language that progressives use to talk about Medicare for all, and they are using it as a platitude now. It means nothing now. Because when we say that healthcare is a right, we make the next logical jump and say, therefore, government should provide healthcare to everyone in the country. Nobody should die. Nobody should go bankrupt if they don't have healthcare. But then they just say, oh, healthcare is a right. Therefore, we want to make sure that everyone has access to healthcare. That doesn't mean anything. So they're focusing on just the Republican Party's flaws because the DCCC instructed them to do just that. Why? Because they are corrupt and because lobbyists are taking control of the DCCC. This is an organization that's supposed to get Democrats elected, and they're fighting to make sure that only the most moderate, pro-corporate, business-friendly, big business-friendly, more specifically, Democrats get elected. Anytime there's a progressive running, like Laura Moser, well, they fund opposition research on her, and they attack her. They try to convince and bully progressives like Levi Tillman out of congressional races. They only want their corporate stooges in office. And this is why Democrats are losing support among millennials. This is why when you look at the generic ballot, Democrats have lost their advantage. It's because they still haven't learned their lesson. They don't stand for anything. And the reason why they don't stand for anything is because they are literally paid to not stand for anything.
Support this podcast by becoming a patron at patreon.com/Humanist Report.